Our next speaker this afternoon is Julie Snyder. She's Vice President, Corporate Relations at BlueCross BlueShield of Western New York. She provides strategic leadership for corporate communications, media relations, and key corporate initiatives, including an impressive prescription drug abuse awareness campaign that she's going to share with us this afternoon. Julie?
Great. Good afternoon, everyone, and welcome from sunny, warm Buffalo, New York. It's 59 degrees, and we have no snow. Just a little background on our Blues plan. We have been in the community since 1936 and cover about 800,000 lives. HealthNow New York is the parent company, and our market, just to give some background, our 2010 census, which is the most recent complete data on the Buffalo-Niagara MSA, puts us at about 1.1 million. And just some statistics about our region, including the fact that Niagara Falls, New York has a very large air reserve station. We also have significant private sector employment. And although we are enjoying an economic and cultural renaissance, I don't think the Buffalo Bills can be counted in that. About 3 years ago, we became aware as a health plan of an alarming trend. Some of the statistics are statistics that have already been shared on this webinar. What really galvanized us was around the use of painkillers by teenagers. Basically, understanding the statistic that more than half of the abusers of prescription pain meds are between the ages of 12 and 25, and a generation of kids really raised feeling very sort of safe and secure in using meds, a very different generation than the one before. And this came home for us as a health plan. Really, it started with one. It started with one parent coming to us about their son, an architecture student with Crohn's disease who was prescribed into addiction. And ultimately, that addiction led to heroin and ultimately to his suicide. And the father's plea, Avi Israel, was that as a health plan, we were one of many stops where he came for help. And at the end of the day, he said, if we can do one thing, it would be to educate the community and educate especially young adults and their parents about the risks of prescription pain meds. He wasn't alone, and I know many people on this webinar probably watched the 60 Minutes episode yesterday on what's going on in Columbus, Ohio. It's a story that's repeating itself pretty much everywhere. Young adults who have become addicted and ultimately go to heroin, and it's a short runway to suicide. So as a Blue Cross Blue Shield plan, we felt that because there was such little awareness that we would launch a community awareness campaign. And we started with the medical community because we did not want to sort of demonize the provider community that, as you all know, had been really moved away from grinning and bearing it when it came to pain management, to making sure that patients, really all patients, regardless of what their diagnosis was, did not have pain. We went around and saw community and media buy-in. We created a middle school-based curriculum, again, trying to get upstream to get sort of a way to stop children from even trying pain meds, and worked with our PBS affiliate to fund a fairly compelling documentary, really to launch dialogue throughout our region. We also found that there was a great need for a 24/7 hotline that could help parents or individuals, sort of a single stop where they could go to get help. We partnered with a local health provider to do that. We raised funds to really finance the overall campaign. We decided not to go through government channels, but rather the private sector and local foundations. We were not going to really focus on advocacy. We wanted to really keep this very contained to be an awareness campaign, and we definitely leveraged our brand in the community to step into an issue that really was not something that anybody else was covering. The response just from going out and talking to media partners and our agency of record was overwhelming. Everyone said yes. Everyone said yes. We didn't get one no. And everyone had a story. There wasn't one meeting we had, and we probably had 50 or 60 meetings in the community to start to launch the campaign. Everyone at the end of every meeting would pull one of us aside and say, this is going on in my family. And I thought that was very telling for us. So we called it Project Hope. Again, all of the elements that we envisioned really came to pass, including information cards that we created for pharmacies and doctors' offices, aggressive PR. We launched a website and the hotline as previously discussed. And what I thought I would do is just share the elements of the creative campaign. And I know I'm going to have help from my friends at NIHCM for this. The first thing we're going to play is the 30-second television commercial that we produced. And it's one of 4, actually, but we'll play this first.
There are 2 things you need to know about prescription painkillers. The first is that they're good for relieving pain after surgical or dental procedures. The second is that they're opiates, just like heroin, strong enough to take away any pain. Except, sadly, the kind that comes with losing a child to painkiller addiction. Know the facts. Visit painkillerskill.org today.
Okay, the next, I'm not sure if that, if someone, Karen or someone on the conference, can you confirm that TV spot was able to be seen?
We could see it.
Okay, great. So the next item is a 60-second radio spot, and again, I'll just assume you can hear the audio.
There are lots of ways to have a killer party. Taking prescription drugs like hydrocodone, Oxycontin, or Lortab shouldn't be one of them. Because while you may think that prescription drugs are safer than street drugs, the fact is they're not. Prescription painkillers like these are opiates. Just like heroin, they have the same effect on the human brain as heroin, and they are just as addictive as heroin. That means it won't take long before those pills get a hold of you, and once you're hooked, your life will never be the same. So think twice before you take someone else's prescription meds at a party. And don't bring your prescriptions or your parents to share with others. Because a killer party is great, but a party that ultimately kills a promising future, that's another thing altogether. For more information on the dangers of prescription drug abuse, visit painkillerskill.org today.
Thank you. And then I'm just going to share a introduction of our documentary that was produced locally by our PBS affiliate. And I'll hit play here, I hope.
Prescription pills are floating around high schools like pencils and textbooks.
Even though you may try and get away from it, in your sleep, it will speak to you.
Every 19 minutes in this country, we lose a person to opiates.
Once known as the quiet epidemic, painkiller addiction is taking the lives of our young.
Prescription pills are floating around high schools like pencils and textbooks.
Even though you may try and get away from it, in your sleep, it will speak to you.
Okay, I'm not
Every
sure.
19 minutes in this country, we lose a person to opiates.
Catherine, if we want to just move on and we can provide this link again.
Sure, yeah, we have the links in the slides up on our website, so if you couldn't hear the audio or see it, people can go and take a look at the videos.
Yeah, I'm getting some messages too that there's can't hear the audio. So we'll make sure that we have those links available to you afterwards. And I do apologize, best intentions, but we had many elements in the campaign. This is a picture of the outdoor billboards that were very prevalent throughout Western New York, probably for about 90 to 120 days, and we had great placement with our media partners. We also launched this with a very large media event at a local college and had this display both at the college as well as reproduced it for the different middle schools for the curriculum. And we also, I believe, had this on site for our own workforce to sign their name to that pledge. These are the information cards that actually virtually every pharmacy in Western New York was more than happy to stock these cards at their counters. As you can imagine and probably are aware, more armed robberies are occurring in retail pharmacies than in banks, at least in Western New York. And so these cards are being used and distributed at pharmacies, at physicians' offices, and most recently by the Western New York Labor Council, which has really endorsed the campaign. So we wanted to just increase awareness and provide education to the medical community, increase awareness of the issue to our community at large, and really provide a resource to parents and young adults. And after we did the campaign in 2013 into early 14, we surveyed, and people certainly recalled seeing the campaign, and that indeed it did achieve its primary goal, which was to increase awareness. Out of it, from the survey, many consumers recognize that painkillers are addictive, and up to a third stated that painkillers are a synthetic form of heroin. Action taken not as encouraging. 62% had not done anything as a result, but 20% discussed the topic. About the same number expired, got rid of expired drugs, and about 10% had conversation. The campaign, and I think that as we talk about the campaign, the real impact was the fact that there were not really many widespread public awareness campaigns that linked painkillers to ultimately to death. And I think because of that and the timing of the campaign, our agency of record, Eric Mower and Associates, and BlueCross BlueShield submitted the campaign both locally, state, and for a few national awards. And we were really humbled that the campaign was met with such widespread recognition. But really there's more to be done. I don't at all want to act like the campaign achieved phenomenal results, because we are still in the midst of an epidemic in Western New York, and this is the headline from about a month ago's Sunday paper. Along with stories. So we've had 147 opiate-related overdoses so far in our county, and predicting about 275 by year end. So we still very much are in the midst of this, and the statistics are listed there, at least for our market. And I also would say there's more to be done, because these are three of the hundreds of young adults whose lives have been lost because of this. The next steps are really being done in conjunction with the BlueCross BlueShield Association that has aligned and endorsed this local campaign, and in fact is funding now a national documentary that will be produced by WNED, but sponsored by the Blue Cross Blue Shield Association and available for use and broadcast in other PBS markets throughout the country. So that's a look, and I do apologize that the creative from the campaign did not launch or was visible, but I will tell you that it probably has been one of the more rewarding things that we have done at this health plan, and we're very honored to be included in today's webinar.